Hey everyone, and welcome to another deep dive. This time, we're taking on a topic that I know a lot of you expecting parents out there are really interested in. We're doing a deep dive on preeclampsia. And wow, did you guys send us a ton of research on this one? Clearly, a lot of you are eager to really get a handle on this whole preeclampsia thing, and for good reason.
Definitely.
It's one of those things that, you hear about, but maybe you don't fully understand. And with all the new research coming out, it feels like a good time to really dig in. So let's unravel the mysteries of preeclampsia together.
Absolutely. I think, understanding preeclampsia is just so crucial. And thankfully, the research is giving us more and more insights all the time. A lot of people think it's just, oh, high blood pressure during pregnancy, end of story. But it's really not that simple. It's actually a very complex condition with a whole range of potential implications that we really need to be aware of.
Right. It's not just like, oh, my blood pressure's a little high today.
Exactly.
So let's just start with the basics, for anyone who's tuning in, and maybe this is the first time they're really thinking about preeclampsia. What exactly is it?
So, in the most basic terms, preeclampsia is diagnosed when a pregnant woman develops high blood pressure and protein in her urine after 20 weeks of pregnancy. It can also be diagnosed if a woman, after 20 weeks of pregnancy, shows signs of organ damage, even without having high blood pressure.
Oh, wow. Okay, so it's more than just a slight bump in blood pressure.
Exactly.
We're talking about very specific criteria here.
Precisely. And this is why early detection is so crucial, because the earlier we can identify it and start managing it, the better the chances are for a healthy pregnancy and a healthy delivery for both mom and baby.
Now, we've heard of mild preeclampsia and severe preeclampsia. Is that just about, like, how high the blood pressure gets? Or is there more to it than that?
That's a great question. So while both types of preeclampsia require careful monitoring, they do have some key differences. Mild preeclampsia might involve slightly elevated blood pressure and a small amount of protein in the urine, whereas severe preeclampsia involves much higher blood pressure readings and can start affecting other organ systems. And that's when things can potentially become much more serious, even life-threatening.
Wow. So something that really stood out to me in this 2023 study from the University of Melbourne was the increased risk for certain groups of women. It mentioned Black women and women of South Asian origin being particularly susceptible to developing preeclampsia.
Yeah, and that's a really, really critical point that you bring up. And unfortunately, it highlights the disparities that we see in healthcare across many conditions, not just preeclampsia. It's a stark reminder that, doctors really need to be extra vigilant in monitoring these specific populations. Why exactly these groups face a higher risk is still an area of ongoing research. We don't have all the answers yet, but it definitely underscores the need for individualized care and awareness.
Yeah, it certainly adds another layer of complexity to this whole thing. Now, I know you spent years researching this condition, so can you finally shed some light on what actually causes preeclampsia?
Oh, I wish it were that simple.
Right.
If I had that magic bullet answer, I'd be shouting it from the rooftops. But unfortunately, the exact cause of preeclampsia is still a bit of a medical mystery. It's like we've got this giant jigsaw puzzle, and we're still missing a few key pieces.
So frustrating. But I imagine researchers have a few good leads, right?
They do. Organizations like the Mayo Clinic have done amazing work identifying risk factors. For example, if you've had preeclampsia in a previous pregnancy, unfortunately, that puts you at a higher risk of developing it again. Carrying multiple twins, triplets, that also increases the chances.
So those are things you can't necessarily control, right?
Right.
What are things you can control, like lifestyle? I mean, everyone always says stress causes preeclampsia. Is that a myth? Or is there truth to that?
It's interesting you mentioned that because while stress doesn't directly cause preeclampsia, it absolutely plays a role in our overall health, especially during pregnancy.
Right.
And so managing stress can definitely help keep your blood pressure in check, which is obviously important for, all the reasons we're talking about.
Right. It all ties back to blood pressure, doesn't it?
It really does.
Okay, here's a curveball I found in the research.
Okay.
There was a 2017 case report about a woman who had preeclampsia but didn't have high blood pressure.
Isn't that fascinating?
How is that even possible? It's like saying you had a blizzard but no snow.
I know, it really challenges our assumptions about what we think we know, right?
Yeah.
And I think that's why this case was so groundbreaking, because it highlights that preeclampsia can present in these very unusual ways, and it really underscores the importance of regular prenatal care, having those appointments where healthcare providers are trained to spot those subtle signs, those things that maybe you wouldn't even think to mention otherwise, but that could be really important.
It's a good reminder that medicine is rarely black and white.
Never.
There are always exceptions, and new discoveries are being made all the time. Speaking of discoveries, even the experts don't always agree on the best course of action, right? We came across this 2019 study by Professor Rachel Fox that pointed out inconsistencies in how doctors monitor babies during preeclamptic pregnancies.
And that's always a little,
A little unsettling.
it can be, because it's like, wait, shouldn't we have this figured out by now? But that's the thing about research. It's always evolving.
Right.
What we thought was the best practice 10 years ago might be completely different today because we have new evidence, new studies, new perspectives.
So even with all this research, there's still debate and this pressing need for more standardized guidelines, which is,
Absolutely.
which is both exciting and, if we're being honest, a little overwhelming.
100%.
When you're just trying to make sense of it all as an expectant parent, it can feel like a lot. But that's why we're here. So let's say someone is diagnosed with preeclampsia. What happens next? Is there like a one-size-fits-all treatment plan? Or what can they expect?
That's a great question. And you're right, there's no one-size-fits-all approach. Treatment really depends on a couple of things. It depends on how severe the preeclampsia is and how far along you are in the pregnancy.
Makes sense.
Yeah, I mean, the Eunice Kennedy Shriver National Institute of Child Health and Human Development, or NICHD, has some really great guidelines on this. For instance, if the pregnancy is at 37 weeks or later, delivery is often the safest and most effective way to manage the condition.
So sometimes the best treatment is to help the baby arrive a little earlier.
Exactly. But of course, if it's earlier in the pregnancy, doctors will explore other options to manage the mother's health and give the baby as much time to develop as possible.
Right.
We want to keep that baby cooking for as long as we can, safely, of course.
Of course, of course. And in those cases, I imagine medication often comes into play, right?
Absolutely.
What are some of the medications that doctors use to manage preeclampsia?
So two medications that are commonly used are methyldopa and labetalol. Methyldopa has been around for a while, and it has a really strong safety record for use during pregnancy, which is obviously critical.
Yeah, you don't want to be messing around with anything that could potentially harm the baby.
Exactly. And labetalol is another good option because it's really effective at controlling blood pressure without significantly affecting the baby's heart rate, which is another concern with some blood pressure medications.
So it's all about finding that sweet spot,
Right.
managing the mother's blood pressure effectively while also ensuring the baby's well-being. It's a delicate balance.
It really is. And, it's a team effort.
Right.
The doctor, the patient, everyone working together to make the best decisions for both mom and baby.
We've talked about the types of preeclampsia, the causes, the treatment options, but let's address the elephant in the room,
Okay.
the potential complications.
Yeah.
What are the risks if preeclampsia isn't managed effectively?
That's why we're having this conversation, to emphasize how important early detection and proactive management really are. Preeclampsia can affect multiple organs. Some organs are particularly vulnerable, like your kidneys, your liver, and your brain.
And in some cases, waiting for a natural birth just isn't an option, right?
You're right. If preeclampsia becomes severe or if it develops very late in the pregnancy, delivery might be necessary even if the baby is born prematurely. And again, it goes back to that risk-benefit analysis. The priority is always the health and safety of both the mother and the baby.
So it's a risk-benefit analysis at every stage.
At every stage, from the moment preeclampsia is diagnosed, throughout the pregnancy, and even postpartum.
And speaking of postpartum, we'll definitely circle back to that because it's not like preeclampsia magically disappears the moment the baby arrives.
Exactly. It's something we need to keep an eye on even after the baby is born.
This quote we found from Ian Wilkinson, a clinical pharmacologist in The Guardian, really sent chills down my spine. He said, and I'm quoting here, "The two major complications in preeclampsia are stroke and prolonged fitting. In preeclampsia, elevated blood pressure and leaky capillaries can cause a bleed in the brain, leading to a stroke. Additionally, inflammation in the brain can trigger seizures, fitting." It's a scary thought, and it really emphasizes the potential severity of this condition.
It does. And, what's even more concerning is that these complications often become more severe when symptoms are missed. Like if a woman is having severe headaches, but maybe she doesn't mention it, or if the monitoring isn't as thorough as it should be. And again, this isn't meant to scare anyone, but rather to empower women to advocate for themselves and to stay informed.
Knowledge is power, as they say.
Mm.
And speaking of knowledge, we came across some information about HALP syndrome. Can you explain what that is and how it relates to preeclampsia?
Absolutely. HELLP syndrome is a serious complication of preeclampsia, and it's actually an acronym. It stands for hemolysis, elevated liver enzymes, and low platelet count. Essentially, it affects your blood and your liver, and it can be life-threatening.
So it's like preeclampsia took a turn for the worse.
In a way, yes. It often requires immediate medical attention, and in many cases, early delivery of the baby is recommended.
Okay, so we need to be aware of this even after the baby is born, right?
Right.
This isn't just a during pregnancy kind of thing.
You're exactly right. Postpartum preeclampsia usually appears within 48 hours of giving birth, but it can actually occur weeks later in some cases.
So even when you think you're in the clear.
Don't let your guard down. New moms should watch for the same warning signs: high blood pressure, protein in their urine, and any other unusual symptoms. Keeping those lines of communication open with their healthcare providers, even after they've left the hospital, is crucial.
It's all about staying vigilant and informed. On that note, let's transition to a more positive aspect. We've covered the seriousness of preeclampsia, but what about prevention? Is there anything women can do to reduce their risk? Or is it just one of those things that you have no control over? So while we can't completely eliminate the risk, there are definitely things women can do
Right.
to stack the odds in their favor.
Absolutely. I mean, a healthy lifestyle goes a long way, right?
Right.
Maintaining a healthy weight before and during pregnancy, eating a balanced diet, getting regular exercise, those things can make a real difference.
And of course, we can't underestimate the importance of good prenatal care.
It's essential. Attending all your prenatal appointments, even when you're feeling great, keeping your doctor in the loop about any changes or concerns you have, and being proactive about monitoring your blood pressure.
Speaking of which, we have all this research about home blood pressure monitoring. What's the deal with that?
Yeah, so home monitoring is becoming increasingly popular, and for good reason. It really empowers women to take control of their health. You know, we came across this 2023 study in BMC, pregnancy and childbirth, showing that home blood pressure monitoring can actually lead to better outcomes for both mother and baby.
So it gives you that peace of mind.
Exactly.
Allows for early detection of any potential issues.
Absolutely. Early detection is key with so many things, but definitely with preeclampsia.
Knowledge is power in this case.
100%.
The more informed you are as an expectant mom, the better equipped you'll be to advocate for yourself and to make choices that support a healthy pregnancy. So we talked about lifestyle changes, good prenatal care. Is there a medical intervention that can help prevent preeclampsia?
There is. Low-dose aspirin has actually shown a lot of promise in preventing preeclampsia, especially for women who are considered high risk. Both the U.S. Preventive Services Task Force and the American College of Obstetricians and Gynecologists recommend low-dose aspirin for these women, ideally starting around week 12 of their pregnancy.
Okay, so when we say high risk, what exactly does that mean? Who should be talking to their doctor about low-dose aspirin?
That's a great question. So women with a history of preeclampsia, particularly if it led to an early delivery, are definitely considered high risk. Also, women with chronic high blood pressure, kidney disease, autoimmune disorders, diabetes, those are all kind of red flags. And of course, carrying multiple significantly increases the risk.
Right, right. And just to be clear, we're talking about a low-dose aspirin, 81 milligrams, not the regular strength you'd grab for a headache. Don't go experimenting with dosages.
Exactly. Always, always consult with your doctor before starting any new medications during pregnancy. They can help you weigh the risks and benefits for your specific situation.
Right, it's always better to err on the side of caution. Now, before we wrap up, let's touch on the blood pressure monitoring one last time. If someone is diagnosed with preeclampsia, or even if they're just considered high risk, should they be rushing out to buy a blood pressure monitor?
You know, it's definitely worth discussing with your doctor. They can help you decide if home monitoring is right for you, based on your specific situation and risk factors. But if you do choose to monitor your blood pressure at home, the key is to invest in a reliable and accurate device.
Okay, any tips on choosing a good monitor? Because there's so many options out there.
Oh my gosh, I know, right? It can be super overwhelming. So first of all, I would say avoid the wrist and finger monitors. Those tend to be less accurate. Stick to an upper arm monitor that's been clinically validated. Two models that consistently get high marks are the CheckMe BP2 and the Opsaline Pressure X Pro. Those are good ones to start with.
Excellent recommendations.
Yeah.
And then once you have the monitor, you need to know how to interpret those readings, right? I mean, not all of us are cardiologists.
Exactly. Luckily, the American College of Cardiology and the American Heart Association have some really great resources on their websites. They have these blood pressure charts that clearly explain what's considered normal, what's considered elevated, what's considered high. And of course, your doctor can walk you through it as well. The bottom line is, if you're ever unsure about your blood pressure readings, don't hesitate to reach out to your healthcare provider.
Right. Better safe than sorry. Always a good rule of thumb. So, as we wrap up this deep dive into preeclampsia, what are the key takeaways you want our listeners to walk away with?
I think the most important message is that while preeclampsia is a serious condition, it's not an automatic crisis. With knowledge, proactive management, and really open communication with your healthcare provider, you can significantly reduce those risks. Early detection is key, and that means knowing the symptoms, understanding your individual risk factors, and being vigilant about monitoring.
And the good news is that research is constantly evolving,
Always.
which means there's hope for even better prevention and treatment options in the future. There's always something new on the horizon.
Exactly, exactly. And it makes you wonder, what if we could identify women who are at risk even before they conceive?
Oh, wow.
Imagine the possibilities. If we could intervene that early and potentially prevent preeclampsia from developing in the first place, I mean, that's the really exciting direction that preeclampsia research is headed.
That is an incredible thought. And to our listeners, if this deep dive has sparked your curiosity, we encourage you to keep exploring. There are incredible resources out there. The Preeclampsia Foundation, the American College of Obstetricians and Gynecologists, even your local library can point you in the right direction. The more you know, the more empowered you'll be to navigate this complex condition and advocate for the best possible care for yourself and for your baby.
Well said. Knowledge is power, and in this case, it can be life-changing.
On that note, we'll wrap up this deep dive into preeclampsia. Thanks for joining us. We'll see you next time for another fascinating deep dive into a topic you care about.